Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health. Who is Kaleida Health? Kaleida Health, we are the hospitals: Buffalo General Medical Center, Oshai Children's Hospital, Gates Vascular Institute, Millard Fillmore Suburban, Visiting Nursing Association, as we commonly refer to it, and throughout Western New York as the VNA, DeGraff Medical Center. We have a few clinics. We have an adult clinic called the Hurdle Elmwood. We have a few pediatric clinics, one on Niagara Street, another one on Broadway Avenue. We have services specifically for women clinics, and we have one on Niagara Street, as well as one on the campus of ECMC. That's on Kensington Avenue, where a bus stops right in front of that, as well as one on Niagara Street. We have two long-term care facilities. We have one facility which is at DeGraff Long-Term Care. That's in North Tonawanda. And we also have one at the corner of Michigan and High Street called High Point. So, and that's just a brief, just a small little geographic picture of who Kaleida is. Kaleida not only has outreach, we also have a brand new initiative in the area of workforce development. So if you have questions on workforce, getting a job at Kaleida, career paths at Kaleida, or outreach and speakers at Kaleida, please call 716-863-8717. Again, that is 716-863-8717. Kaleida is hiring, and also I'd like you to remember, don't forget about the marathon, Memorial Day weekend. Kaleida Health needs volunteers for the Buffalo Marathon. For more information on that, please Google Buffalo Marathon, and there's a volunteer section. Well, our guest for today, that's why I kind of zipped through that. We have three guests for today. Our topic is talking about the water quality. Fluoride has been taken out of water. I don't know if it's just Buffalo, Western New York, but you know what? That's a question our guest will be discussing. Fluoride is good for your teeth. Fluoride prevents cavities. And they'll let me know if fluoride keeps your teeth whiter or not. Anyway, our guest for today, Dr. Fristino. Good morning, Dr. Fristino. How are you?
Good morning, Francesca. I'm well. Thanks for having me.
Oh, great. And your title?
I'm the Director of Oncology Research at Erie County Medical Center and a staff clinician in the Department of Dentistry.
Yeah, thank you. And we have a new guest and Dr. Fristino has been with us before. And we have Dr. Hutter. Dr. Hutter, could you please give your title? Good morning.
Hey, absolutely. Good morning, Francesca, and to all the listeners out there. I just wanted to start by thanking you for this opportunity to have the ability to not only chat with you, but also the listeners, and also thank Kaleida for their help in this. But my name is Josh Hutter, and I've been a dentist for 18 years. I'm currently the president of the 8th District Dental Society. What's nice about the 8th District Dental Society is we represent 8 counties of Western New York, and that includes over 1,000 member dentists as well. It's been in existence for over 100 years, and it's definitely kind of the central point of dentistry in the area and among Western New York. We sort of represent not only the dentists in the area, but also our patients, and make sure that our patients are taken care of. What's nice is we have our own series of peer review. We take care and look after each other as well, just to make sure all our members are doing everything they should. And we also like to disseminate information not only to our members, but to the general public as well.
Thank you. And then we have Dr. John Craig, someone who I've worked with for many years. And John, we're just kind of piggyback on that question. If you could give your title, and if you could share with our audience, unless Dr. Hutter said it all, if you could share with our audience give your title and let us know, again, what is the 8th District Dental Society?
Yeah, good morning, Francesca. Great to connect with you again, and thanks for having us in to talk about water issues in Buffalo and dental care. I am the executive director of the 8th District Dental Society, and as Dr. Hutter said, we represent the 8 counties of Western New York. There are 13 components in the state of New York, and when a member joins our society, It's a tripartite relationship. So they join not only the 8th District in Western New York, but they also become a member of the New York State Dental Association and the American Dental Association. So as Dr. Hutter said, we provide support for all our members, which there are many. We're lucky to have the UB School of Dental Medicine in our backyard. 70% of our members have been graduates of the University of Buffalo. So we really have a great network and community of professionals here in Western New York. So it's a great organization to be a part of. As Josh said, we do support the community and our members in anything dental related. And getting information out, doing professional development for our members and their staff, and as well as other outreach and support services. So thanks for having me in.
Oh, you're welcome. I just have to add on a personal note. I love my dentist. I have so much fun when I go to the dentist. And you really should enjoy your dentist, because the first thing people see when they see you, when you say hi, is your teeth and your smile. And nothing better than having full confidence and beautiful smile. And as my sister would say, only floss the teeth you want to keep. All right, on with the interview. There. So let's talk about fluoride, because the reason why we're talking about this is because there has been conversation about how fluoride was taken out of, you know what? And I'll let you fill it in. Why is fluoride so important to the teeth? And is it important to adults as well as children's teeth?
I mean, that's a phenomenal question. And the obvious answer we always hear is, yeah, certainly fluoride is always good and healthy for anybody's teeth. But I really think it's important to kind of look at how critical and important it really is. For a lot of people, it's sort of their first line of defense. And unfortunately for others, it's actually their only line of defense in terms of preventing cavities and sort of taking care of their oral health. What's nice about it is, for most of us, it's naturally present as an additive in the water supply. And unfortunately, we found out just in the city of Buffalo, so Erie County is okay, it's just the city of Buffalo, that for just shy of 8 years, fluoride was removed from the water. And it was one of those things that, unfortunately, there wasn't much notification about, and it kind of came out as an indirect way. Ideally, in any type of fluoridated water systems across the country, the CDC would like to see 0.7 parts per million, but currently the city of Buffalo is at 0.13 parts per million, which is approximately 5 times less than what's recommended and effective for patients.
Oh my gosh. Well, thank you. And when we just said how it's been missing for 8 years. So if it's been missing for 8 years, what are some possibilities that could have happened to people's teeth?
It's sad to admit, but you're certainly looking, it starts at the level of the cavity itself. So unfortunately, it causes, or at least increases, the risk that a lot of susceptible people, especially certain populations, are going to be prone to getting cavities. And unfortunately, once the chain of cavities start, there's sort of a point where it will continue to progress, no matter if you reach a point where you become much more diligent with your oral health. So that's where fluoride comes in. It sort of prevents that first initiation step of where caries or dental cavities can progress. And unfortunately, in children, dental cavities are the number one chronic disease. So whatever we can do to help the children of the area is certainly important to us. I was researching a little bit of information, and on average across the country, school children that actually have fluoridated water on average have about 2.25 fewer decayed teeth. So there's certainly very empirical evidence just to show how much it does prevent cavities, and sort of just even for adults too. As adults, we tend to have more dental work done, and the fluoride kind of helps prevent sort of seeing that kind of dissipate, as well as the increased risk of cavities in adults as well. On TV, you sort of hear these little commercials about possibly getting soft spots on your teeth and using this and using that. And that's where fluoride comes in. It actually is able, almost on a molecular level, to actually strengthen the tooth. And here's what's interesting is that it actually makes the tooth stronger than it was originally. So not only does it prevent cavities, but you truly are making the tooth stronger and much less likely to develop cavities. And again, that's where the cascade starts. Untreated cavities do turn into, unfortunately, the nerve of the tooth dying, which then can ultimately lead to infections and abscesses, which sadly can spread to the head area, the head and neck area.
So you just mentioned something I've never paid attention to in a commercial. It's either Dr. Faustina or Dr. Hutter. What is a soft spot on your tooth? I'm like, now you have me sitting here tapping each of my teeth. I've never even heard that. I don't know, either one of you, Dr. Faustina, what does it look like? What should I be looking for?
So sometimes if the enamel doesn't fully form, or the outer hard layer of the tooth, you can have a softer spot, and that can be seen as either like a yellow or grayish spot, or a very white chalky looking spot. And we can get that if there's not the full composition of the enamel. And a lot of times that happens when there is lack of fluoride or lack of enough fluoride in the development of teeth. And that's why fluoride in the water is so important, especially in the development of teeth in children. That's where it really comes into play.
All right. Well, you know what? I'm just throwing it's a simple question. I always like to ask people questions when I'm doing the show. Wherever I am. Yesterday, I was at an office and I explained the topic, and the question came up talking about fluoride. And this person boils their water for their drinking water. And they were just wondering, when you boil water, just as drinking water, are you losing fluoride by boiling water? That was the question.
I'll tell you what, that's a tremendous question. That's one that we actually don't receive often. So I'm actually kind of glad that came up in topic. The good news is it does not remove fluoride. Boiling water it's effective to remove, like, for example, things like chlorine from the water. But the good news is that if you boil your water, fluoride levels still will remain intact. So, that's good news for those out there for whatever reason, if they just prefer, a warmer water, or if there are boil orders, the good news is that fluoride is still intact and still effective for those patients.
So how is it added to the water? And is there anything we can do as listeners to add fluoride to our water?
That's an excellent question. And honestly, that's kind of the crux of what happened with the city of Buffalo. About 8 years ago, again, when this sort of stopped, Buffalo was in sort of the older method of adding fluoride to water, which was simply basically adding fluoride powder into their water source. And a lot of communities and a lot of technology, you fast forward, have actually created a system where the fluoride's actually in a liquid version that you add to the water. And what's nice about it is it's a lot more computerized, a lot more advanced. So it's a lot less work on the end of the water department in terms of facilitating that. So that's currently what seems to be the holdup. The water department did express a little concern about lead leaking within the water system. They compared it to Flint, Michigan, for example. But the good news is there's two different kind of situations, or kind of comparing apples to oranges. And by converting to this new effective system, it actually has zero result on any type of possibility that lead could be introduced in the water system. Flint, Michigan had an issue with something called orthophosphate. So the good news is by switching to this new effective method, it causes absolutely zero increase or chance or risk that that lead would be introduced into the water supply.
Mm-hmm. So is there, and maybe I missed it. So is there anything you can do to, there's so many things you can add to everything, it seems like, for flavoring and this and that. So is there anything you can buy, online or something, fluoride, to add to your family's drinking water?
So there are bottled water with added fluoride. One specifically is called nursery water. But the best thing to do right now, while the city of Buffalo does not have fluoride in the water, is to find an alternative water source, if you can. So if you can find water from somewhere else in Erie County or Niagara County, like Williamsville, Hamburg, Orchard Park, Niagara County, anywhere, that really is the best way to supplement fluoride for children at this time. And then, of course, talking with your dentist or your child's dentist about fluoride supplementation. There are prescriptions that can be taken daily that the dentist would have to prescribe, as well as prescription toothpastes and fluoride gels for adults. So there's different guidelines based on age of, children versus adults for fluoride supplementation. But at this time, you can purchase water with fluoride added or try to find an alternative source of water from family or friends that live outside of the city of Buffalo.
Yeah, and I know I have a dentist appointment, I think next month, but I will ask about the toothpaste. I didn't realize that there was a toothpaste that you can order. I know hopefully the copay we're in the world of pharmaceuticals won't be too bad. But okay, that is good to know. How about schools? I mean, we're almost out of school, but is there anything that the schools can do, or anything you can send with your child to school if they don't have access to someone who lives in Williamsville in terms of waters, or what, like what can we, anything we can do? Summertime's coming up, summer camp, all that. So anything that, let's say I can recommend to my minister at St. John's, what they can do for summer camp for children.
Yeah, sure. We just actually received a nice communication this morning from Dr. Joe Gamacorda, who handles outreach for the dental school at UB. And he's been working with Erie County Commissioner Gail Burstein, Dr. Gail Burstein, on outreach with the Buffalo Public Schools. And I believe a meeting is being planned for May 15th. And I think the plan is to try to assemble some volunteers that can go out to the schools, but certainly share information that can be shared with teachers, school counselors, and certainly, building-based nurses and the central administration on what families can do for their kids through the summer, because that's certainly a disconnect, as you know, Francesca, because when kids disconnect from school, a lot of that communication, whether it be, lunch support or other types of school-based support for many, many families, ends, and it doesn't pick up until September. And we have the understanding from the city of Buffalo's water board that they may be introducing fluoride back into the system in October, but that's right when school starts, and that may even be delayed in October. So we may move into, early, late fall, even early winter, where fluoride may not be introduced. So I think there are some plans to do some engagement at the school level with appropriate staff. And I know Dr. Faustino has children in the Buffalo schools, and she has mentioned that they do a great job of communicating on a number of different platforms, whether that be sending text messages, doing robocalls, sending information with students that they can take home. So I think a lot of it is just communication and efforts of engagement that we can share with the school-based people. And hopefully that gets out to families. And certainly that's a great idea, Francesca, getting it out to our faith-based groups as well.
Well, and I have to say, there are many large camps that have large numbers of children. And if you need, we can talk offline. I believe United Way has one of those lists, but there are a couple of camps that have here in Buffalo that have several hundred children. I'd be more than happy to share that information with you to make sure that the children who are going to camp, nothing wrong with hitting people 2 or 3 times, sending the message 2 or 3 times to the families, because many of our children in the public schools, and again, I hope you're also targeting the charter schools, but many of our children who are in the younger children in public and charter schools are some of the same children who are filling the seats in some of the summer camps. So I would, I'm hoping that message, and I can help you with, giving you some names of, for both if you need the charter school list or the information for the summer camps. Okay.
Yeah, and that to piggyback, and then I'm sorry to interrupt you there, Francesca. I mean, I think that's wonderful because I can tell you, from the 8th District Dental Society and those also that are members, we have a group of, like I said, 1,000 dentists that are very, no pun intended, but salivating to try to help the public as much as they can. So, for such community events and children's camps and houses of worship, there's plenty of opportunities for us to kind of get the word out there and honestly just answer questions, even if it's just filling people and patients into information. We're more than happy to help. Our goal is, number one goal has always been to get fluoride back in the water as soon as possible and keep the public aware of the situation as it progresses. So, there's certainly not going to be any shortage of volunteers that we can find to help out with such events.
Yeah, because when you think about your primary care, I don't know if everyone necessarily thinks about their dentist. Again, which I say, that's the first thing people see when you smile is your mouth. So, and if this is, it's like a two-pronged message. Have you seen your dentist? And this is what you can do. But anyway, we can talk offline on that. Toothbrush. Okay, toothbrush. How often? What is the rule on toothbrushes? How often should you get a new toothbrush?
Although there's always a little variation because we do have some patients that are aggressive brushing, which is kind of a little ironic because usually the dentist will be telling patients that, they need to brush here, brush there, brush a little harder. But we also see the opposite where patients can brush a little too aggressively. So what we recommend is on average, 6 months is a good time period to get that new toothbrush. And what's nice is that usually most patients, when they get a dental cleaning, they will receive a new toothbrush. And I guess you hate to admit that bribery still works nowadays, even as we're adults, but it's certainly a way to bribe patients into keeping up with things. But one of the important things that we stress is actually the nature of the toothbrush itself. For example, a few decades ago, it was thought that the more aggressive brush bristles you had, you'd be doing yourself a favor. But it turns out that very aggressive toothbrushes, and in fact, that's why I don't see many of them anymore, sort of had that effect that they would wear down teeth a little faster and wear out parts of the teeth that didn't have enamel covering it. So we recommend roughly on average for the average patient every 6 months, and to make sure that it's at least a soft bristle toothbrush, if not an extra soft bristle toothbrush.
Yeah, hard bristles. I thought for years that was what you go with. Hard bristle toothbrushes to really clean your teeth. So that's wrong.
Yeah, it's one of those surprises that actually will cause some conditions kind of that occur at the root level that actually wear down enamel a little faster, where enamel is sort of the thinnest on the tooth itself and can open up the door to either more cavity sensitivity issues and some gum recession. So definitely important to definitely favor a very soft or extra soft toothbrush when you're looking at them. So
almost like for the mascara wearers, change your mascara and your toothbrush every 6 months at the same time.
Hey, I'll let Jennifer confirm that one. That one I can't confirm, but
I agree.
I agree. Yeah. All right. I'm just looking here at my questions, and I think anything. We have a few minutes remaining. How about bottled water and fluoride?
Great question. And sort of piggybacking on what Dr. Frostino said, there are certain bottled water companies out there that do have fluoride added to the water. But if you're kind of in a tight jam, feel free, friends, relatives, basically any municipality outside of Buffalo does have fluoride in the water. So not to make it a financial issue, but by far your cheapest option is honestly just to call a friend or relative and kindly kind of use some of their water. But for the general public, if you go to your supermarkets, you're going to find that most of, if not all, that bottled water is unfluoridated. They do offer fluoridated water. And I kind of speak specifically from like the office point. So you get those big, gigantic jugs of water. We deal with Crystal Rock at our office, and they do actually have fluoridated water for our water fountains, but you do have to request it. So that would be the important part, is anytime you get bottled water, is just to request it that it's fluoridated.
Francesca, I want to share one thing and kind of piggyback on what you said about primary care. Both dentists and pediatricians can apply fluoride varnish, and that is fully covered by Medicaid for children. So even if someone's not seeing the dentist, but they are seeing the pediatrician or vice versa, it would be really important, especially in this time when there's no fluoride in our water, to talk with your healthcare provider about having that fluoride application in the office.
Yeah, and if I could kind of piggyback, I one of the things that always kind of strike me, we look at our health and we look at bodies, and a lot of things are sort of up to, either habits or chance or honestly just the luck of the draw. But what always kind of struck me is that we look at tooth decay, and pretty much all of it and its complications are preventable. So it's one of those few things that we do have a very active chance and active role in preventing in, ourselves, our children, our relatives. And it's something as simple as just, making sure your water is fluoridated. So, having that first line of defense is pretty effective. And in terms of public health, it's been present since 1962 is when water fluoridation began. And so much so that the current Surgeon General of the entire United States, his name is Dr. Murthy, he actually said that water fluoridation is one of the CDC's 10 great public health achievements of the entire 20th century. So that right there speaks volume, that you have the Surgeon General actually considering oral health, and to come out with a pretty dominant statement saying that's one of the 10 greatest achievements of the 20th century. So just to kind of reiterate how important fluoridation is, for our listeners that sort of want to compare apples to oranges, there's a great article that I'd recommend, and it's called A Tale of Two Cities. And basically what it was is there was two neighboring cities. One city was fluoridated and one wasn't. And it's a great article that illustrated how without fluoride in the water, that the levels of cavities were so much higher in the nearby community that didn't have fluoride.
Thank you. Tale of Two Cities. I remember that. The best of times and the worst of times.
Bingo.
Classic movie. But I'm going to give John the last talking point with giving the phone number. However, Dr. Faustino, I want to thank you for being our guest. Dr. Hutter, I want to thank you for being our guest. And Dr. John Craig, if you could please provide the phone number. And I also want to thank you for being our guest.
Thanks, Francesca. The 8th District Dental Society phone number is obviously 716, but 995-6300. Please call 995-6300. And we will put information up on our website if people wanted to go there. It's the number 8ddsny.org, and that is the number 8ddsny.org. And finally, I just want to say that on Sunday, May 21st, we'll be doing a free screening at the Bison's game that's sponsored by the New York State Dental Association and our local society. So
thank you, John. Yeah. So because we have to end, and I just want to thank our guests today. And next week, you will be hearing from my esteemed colleague, Cindy Bass from ECMC. Be safe and enjoy the weather. And see you in 2 weeks. Francesca Messiah from Kaleida Health. Bye-bye.